Acute issues, hey, you may get an ear infection, you may get a urinary tract infection, you take the medication and you're done. Yeah, you may have to do some things to prevent it from coming back, but overall, it's like a one and done. But with chronic disease, people have to buckle in because this is going to be a journey, baby. Hey guys, Kim here, and you are tuned into Kim E, the Diabetes NP, a place where healthcare professionals can come and learn more about diabetes education and management. We are back for another Lunch and Learn today, and if you're not familiar with what Lunch and Learn is, it's when I pop on and we talk about a focused topic within diabetes management, and we just kind of sit and have a little chat. These go up on Fridays during lunchtime, so you can have enough time to be able to grab you something to eat and then sit down and maybe learn a little something. Very laid back, very as if we were in the break room having just a conversation between colleagues. And so today we are starting a series, or I'll say I'm starting a series, okay? And this month, I really want to focus on patient and provider engagement. Now, for those of you who don't know, I do have a business, Ellis Diabetes Education and Consulting, and that's what I do offline. I do speaking, I do consulting, do a lot of learning and curriculum development for organizations and healthcare systems, and do a lot of like media contributing and things like that. And I have built my business, I have built my brand on three key pillars: preventative care, culturally responsive care, and patient provider engagement. And the reason why I have these three pillars, because when I imagine diabetes management, it's not just about the medications and, the patient's levels and stuff. There are key points within diabetes management that I really focus in on, and those are my three, right? I feel like with prevention, we have to be preventing it, right? One of my favorite quotes, if you follow me for any amount of time, I say this often: an ounce of prevention is worth a pound of cure. If we can prevent it, we don't even have to go through all the trouble. So preventative care, how to do early screening, early detection, early intervention, right? So that's preventative care. And then I also focus in on culturally responsive care, because we all know that the cultural groups that are affected the most are minority groups. So we have to think, well, let me rephrase that. The groups that are affected the most are different types of cultural groups. Our priority groups, our Black population, our Hispanic population, and our Pacific Islander and Asian population, and even Native American, our American Indian populations as well. These are all different and very unique cultural groups. And so we have to keep that in mind when we are approaching our patients. And speaking about approaching our patients, that brings me to my third pillar, which is going to be the theme for this month, which is patient and provider engagement. And so throughout this month, I'm going to be talking about different aspects just to really break it down, because I feel like, and I've said this before as well, words mean things. So when we use certain phrases and words, I think sometimes we can use these buzzwords so often that we forget what the meaning is. So I'm going to be defining some terms for you over this month. I'm going to start today with that. And we're really going to talk about really what is it that we're really trying to achieve, and what is it that we're really doing, honestly. We can tie words to things, and that's actually not what we're trying to do. We're actually trying to do something else. And so with that being said, let's hop right into it, because I actually want to take that last thing that I just said and let's expound on that. So I have my notes here. I have a screen up here, and I have some notes here. And I was thinking about this because I have shared with you all, I do speaking engagements, and over the summer I had the opportunity to present my original work, some of my consulting work at different conferences. And I presented one of my approaches, the diaspora approach, which we are going to talk a little bit more about that throughout the month. But part of my approach, it's rooted and the engagement between the patient and the provider. So let's first, so we're all on the same playing field. Let's define those words. So patient engagement is a broader concept that combines patient activation with interventions designed to increase activation and promote positive patient behavior. Okay. Well, there's a word in there that I feel like we need to dive a little deeper into, and that's patient activation. So, what does patient activation mean? Well, patient activation refers to a patient's knowledge, skills, ability, and willingness to manage his or her own health and care. And research has shown us, and there have been numerous articles, when we're dealing with any condition, but especially like chronic disease, because with chronic disease, the patient is going to be on this journey, right? Acute issues, hey, you may get an ear infection, you may get a urinary tract infection, you take the medication and you're done. Yeah, you may have to do some things to prevent it from coming back, but overall, it's like a one and done. But with chronic disease, people have to buckle in because this is going to be a journey, baby. You know what I'm saying? And so when it comes to chronic disease, it is all the more important that you collaborate with that patient. And honestly, the patient has to drive the boat. We're just there as a guide. And so when we're looking at these two definitions here, what is it that we really want? Is it patient engagement or is it patient activation? Actually, we want to have patient activation. We want to activate our patients to take an active role in their care, right? Now, patient engagement is the broader concept, yes, but what we're really, if we're really trying to be very laser focused on what we're trying to do and help our patients do, we're trying to activate them. We want them to be an active part, right? See those words? Activation, active, right? So that's what we're really doing. We're trying to provide them with the knowledge, the troubleshooting skills, and especially in diabetes, especially with the CDCES, which is the Association of Diabetes Care and Education Specialists. That is one of the hallmarks, are like your self-management behaviors, right? Even the diabetes program, there's two. There's one that's for prevention. There's one that is for the person who already has diabetes. But the whole program is DSMES, diabetes, self-management, education, and support, right? And so it's all about helping our patients to be able to manage their own care better, because truth be told, they're going to spend the majority of the time away from us. We only get a very small clinical snapshot of what's really going on. And to be quite honest with you, we all know that our patients are probably going to present the best in front of us. So that is actually what we are actually trying to do. But to keep things simple, I'm going to continue to use the word engagement, but know that when I'm saying engagement, I'm saying to activate the patient, okay? To invite them to be an active and, might I add, the primary role in the care. And so engagement, with that being said, what I have named to you is very collaborative. It's collaboration, right? Between us and the patient. And so its engagement is very much a twofold approach, right? It's an interdependent relationship between the clinician and the patient, okay? And how we approach our patient encounter largely affects how they're going to approach it. Interdependent. That's what interdependent is, okay? So this was short because, again, this is going to be something I'm going to take through the whole month. It's a conversation that I want to talk about throughout the whole month. So instead of coming over on here and like with my other lunch and learns, I've popped on and I've done 30 minutes and things like that. I kind of want to experiment with this shorter time and see if you all like it. If you do, drop down in the comments, let me know. And again, I thank you all for tuning in every week. I stream this to YouTube, I stream it to LinkedIn and to my Facebook group. So if you're on any of those platforms, go ahead and follow me over there as well. Make sure that you subscribe, follow, whatever the platform asks you to do, and ding the notification bell so you know when I'm going to upload. On some platforms, it's just simply turning on the notifications. So when I post, you know that I've done it. And so anyways, you have been sitting here with Kim E., the Diabetes MP, and we'll catch you on the next one. Bye.